Nearly 24 million Americans over 50 now live alone, and that number is only growing. Our next guest, Nicole Brackett, is on the front lines of solving this defining challenge as Director of Quality and Care Delivery at Homewatch CareGivers. With over 35 years of experience in long-term and dementia care, a background as a U.S. Army veteran, and nearly 22 years championing person-centered care innovation, Nicole brings a rare depth of expertise and heart to this work. From co-developing certified dementia care training to pioneering caregiver education through a cutting-edge learning management system, Nicole and the Homewatch CareGivers team are redefining what it means to age safely and independently at home. Join us as Nicole unpacks the solo aging crisis, the power of proactive care, and why independence lasts longer when assistance starts early. Let's go.
Welcome to Passionate Pioneers with Mike Baselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Baselli. I look forward to having you on this journey with us.
Hi, Nicole. A big welcome to our podcast today. I'm so excited to have you on.
Thank you. Thank you for having me.
Well, given your extensive experience driving person-centered care excellence across long-term and Alzheimer's dementia care settings for over 35 years, and your passion for developing innovative training programs that enhance caregiver quality, as well as professional development within your own current company, I'm looking forward to this important and timely conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Baselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn in order to further the conversations occurring on this podcast. All right, Nicole, it's almost time for our community to learn how you and the Homewatch CareGivers team are pioneering comprehensive home care solutions that bridge the gap for independence and safety, particularly for the growing population of solo agers that are navigating life without traditional family support. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Well, I would advise people to consider shifting their mindset from a reactive, or I'm using air quotes, sick care, to a proactive wellness mindset and adopting an approach of doing with a person needing assistance versus doing for them. The mindset creates an independent relationship and keeps the person in the driver's seat. They're able to call the shots where their own care is being considered. It is also important to foster community, empowering individuals with education and promoting healthy living. It is important to have people embrace technology. It is the way of the future. It is here now. And to understand the actionable data that is created, allowing them to have that freedom to inquire about their own informed healthcare decisions.
It's a great call out, especially in this changing landscape. You mentioned technology and innovation. It's here. It's not going away. If anything, it's getting more and more enveloped into our own lives and all the different kinds of care settings and personal settings, et cetera. Nicole, I have to imagine, we'll talk about this on the other end of the commercial break. Here you are now 20 plus years in at Homewatch CareGivers. That alone is a ton of celebration. I bet you've seen a lot of journey along the way, a lot of change, and a lot of dynamics that, are really fueling those comments that you just made. How important is it to continue to, stay on top of what's happening in the marketplace? And like I said, we'll discuss this in regards to your own journey. But right now, personally, how important is it for you on a personal level to stay on top of those changing dynamics, whether it be technology, innovation, care models, et cetera? The consumers at the end of the day, patients are thinking about the care delivery. How important has that been for you along your own personal journey of being, one of those change agents in our industry?
Yeah, absolutely. It is very important to be the provider for communities who are researching. The consumer is savvy and they're looking for like-minded people to entrust their loved ones' care to, and having those forward-thinking technologies, resources that are relatable to the healthcare providers of their loved ones. It is very important to stay on top of all those things. You need to brush up on what's new, what's out there, do the research, and provide the tools and resources for families and people receiving care to make those informed decisions.
Well, speaking of, we mentioned it on the front end, this whole notion of solo agers. What a fascinating topic, an ever growing one. Lots of change happening. And there are ways to address it. It is something that a lot of people are seeing as an opportunity to really think through, how do we change our care models? I know you and your team are at the forefront of doing exactly that. We're going to discuss your own journey with Homewatch CareGivers and beyond, what's happening in the camp right now, and how we can be supporting you. We're going to unpack all of that and more after we get back, thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you, who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Nicole Brackett, Director of Care Delivery and Quality at Homewatch CareGivers. Nicole, thank you so much for the front-end advice. Love it. Very important, very timely. Now, of course, we got to talk about your own personal journey a bit. Coming in June of 2026, celebrating 22 years at Homewatch CareGivers. That alone is unprecedented. You don't hear about those dedicated careers much anymore. Can't wait to learn how you've done it, how it's been along the way, the journey, that has happened along those 2+ decades. And then, of course, we got to discuss today. We talk about this notion of solo agers. This is a fast-moving dynamic in the market and in our own communities across the nation and beyond. We're going to talk about how you and the team are really solving for that, how things are changing for you and evolving as an organization to then better serve end patients and those end consumers. Then we got to look a little future state. We'll pull that proverbial crystal ball off the shelf, and look a little future state of what you and the team are seeing on the horizon in this ever-changing dynamic, and where you and the team expect to be over the next number of years as well. And then, of course, we can't let you out of here until we can figure out a few ways to help you and the team out. But first, Nicole, again, congrats, coming up 22 years at the organization, a celebration in and of itself. How has the journey been? How did it come to be in the first place? Take us behind the scenes. Take us a little journey of how you got in this space in the first place.
Well, I'll cover the 22 years as quickly as I can, Mike. I started my career as a medical assistant out of high school with the intent of always becoming a nurse. I remember coming home from work one day and seeing the newspaper open. People, hopefully they remember what a newspaper is, right? The ad stated that the Army was training nurses. I immediately signed up, not realizing that joining the Army is everything that it was cracked up to be. The dirt, the push-ups, the drill sergeants, lots of mopping of floors, wearing uniforms, disassembling and cleaning and reassembling my weapon, minimal sleep, not flavorful food at all. I was a bit of a private Benjamin for those who are listening that recall that character. The military, however, grew on me, and I became ever so patriotic and grateful for the experience. My education to serve my country, and also I served during Operation Desert Storm, so yes, that makes me a veteran as well. It was difficult to secure employment, I have to say, after passing my nursing boards, because no one wanted a nurse with no experience, and I can't say that I blame them. Eventually, someone took a chance on me, and I found myself working in Boulder, Colorado, at a long-term care facility for the next 12 years, where I met a fellow nurse who introduced me to Paul Sauer, the founder of Homewatch CareGivers. I have been with the company, as Mike mentioned, for 22 years this coming June. I started my journey with Homewatch CareGivers really just developing training for his caregivers throughout the network. And I worked my way up from an entry-level position of being a specialist to a manager and now the Director of Care Delivery and Quality. I have had the great fortune of working alongside other professionals to develop and adapt and incorporate data-driven, professional, recognized assessment tools in our organization that doctors, healthcare providers recognize. These tools provide outcomes that we can react to, and that allows us to make changes to the care plans before a catastrophic event occurs like a fall, and that helps keep people safe in their homes as they age in place.
What a journey. And of course, thank you for serving an incredible journey along the way, Nicole. And it's amazing those pivotal moments when you meet a certain select few in your life, what it does and the trajectory that it puts it on. Nicole, I got to ask, because, you don't hear many folks anymore spending this much time in one organization. I think it's absolutely commendable and an incredible feat in and of itself. How has that been being part of such a team for 20 plus years? How has that been for you on a personal level?
Well, on a personal level, I came in and I didn't even have a computer at my desk when I started 22 years ago. But Paul Sauer, the founder, was a visionary, and every leader in our organization since has been a visionary. And, where back in the day, we weren't offering the level of services that we are offering today. So when we used to have to say no for regulations and legal purposes, we can now say yes because we've innovated over time, implemented and incorporated service lines that really meets the person where they are and walks the journey with them through the whole entirety, trajectory of their care assistance needed in the home.
That's really, really special. So, Nicole, of course, we got to talk a little bit current state as well. Obviously, things have been changing rapidly. And this notion of solo agers, I think a lot of folks still are maybe needing to learn what exactly that means. And so before maybe we talk about, Homewatch CareGivers addressing this kind of new and changing dynamic in the marketplace, let's start there for a moment. Can you define what solo ager means for the layperson out there that wants to maybe get anchored and maybe find a little bit of understanding before we dive into the details?
Yeah, so a solo ager is an adult that is aging without the traditional family support. Most oftentimes are unmarried, childless, living alone. It is a fast growing senior population, as you mentioned, and people are just choosing to be independent at home and not move in with a family member or into a community living environment.
And are you seeing also the capabilities of technology being able to further enable that as well? Are those some of the reasons why? Like, what are some of the other dynamics? Like I said, we can, use technology. We can stay connected, whether it be wearable devices or telecommunications, et cetera. Has that been a proponent to help with this solo aging concept as well?
Yeah, so technology plays an increasingly important role in how we care for clients. So we offer what we call a total care solutions for individuals who want to remain in their home. And so therefore, we have expanded our home care services to include the safe use of technology. Also, we have implemented nursing services at the end of last year. And so we're focused on making technology accessible and intuitive so that it supports personalized care rather than standardizing it, with systems in place like access to family portals so families can stay informed and involved and as authorized by the person getting care. Incorporating technology really allows us to get somebody into care sooner rather than later. So part of our service line at the entry level is what we call active care. It's for people who are maybe starting to plan that solo aging, and the earlier the better. And we incorporate that technology so that they can stay independent as long as possible in home before they actually might need a direct caregiver in the home. What I like to say is independence lasts longer when assistance starts before the decline.
Let's also reset a bit here as well. There's a lot of great things that we just talked about there, just on the technology side alone, and how you guys are serving these patients, these consumers, the customer at the end of the day, that you guys are really helping be able to and enable to do exactly that. But let's first start there, Nicole. Who is Homewatch CareGivers?
Who are we? Well, we were founded by Paul Sauer over 45 years ago, and he started the company as just a pet sitting business where he was walking dogs and stuff. And then one day he had somebody ask him if he could check in on grandma who was living in the basement while they were out of town. And that's where home care started. And back in the day, Paul wanted to do everything. And, with regulations and the legality of home care and what defines home care, we had to say no, no, no to a lot of things. And so as we have evolved and incorporated, increased state licensure and regulations kind of determine what people can offer within their state. But we do want to be that one-stop shop for individuals who want to receive safe care at home. And the earlier, the better, like I had mentioned, and they can, stay safe in the home. People, I think COVID kind of determined on a lot of the remote care that is happening in the home. And so we incorporated nursing services because there's things that people can do that they would normally leave their home on a regular basis. that can be done in the home, whether it's a dressing change from a hospital stay to, infusion therapy to medication reminders and setup and management. We do want to be the one-stop shop of home care where people can get all their needs met.
So let's get back to this topic of solo agers. It's a big one and one that I wanted to absolutely cover on this episode and for our podcast and community. And so I want to frame it up just a bit again for our audience in regards to some numbers, which is just incredible. With nearly 24 million Americans over 50 now living alone and projections showing 10 million solo agers by 2038. If you think about this massive cohort of just in our own country alone, how is Homewatch CareGivers adapting its care delivery model to address this dramatically shifting demographic landscape?
Yeah, if I could throw out some more statistics, Mike, when we think about solo agers, they're faced with some challenges if they don't do that pre-planning. So what we do know is like 82% of the solo agers worry about mobility and staying independent. And I think I can correlate our professionally developed fall risk assessment, which aligns really well with the CDC's fall risk, identifying risk before that challenge happens. Also, 69% are worried about maintaining their independence. And our model, our approach to care is really fostering that interdependent relationship where it's a two-way street and it's not a one-way street. So solo agers can really think about looking for a company that's going to foster that independence and keep them safe at home without trying to take away their dignity. 57% of those solo agers are fearful of losing their mental engagement. So we have our own proprietary certified dementia care program. We use professionally developed screening tool that allows us to identify risk or concern on the front end of maybe a solo ager not coming in with any kind of concerns about cognition, and we monitor that on a regular basis. Also, 34% of those solo agers are fearful of social isolation. So we build social engagement right there into the care plan, and it's important for them to stay engaged. And I hope I'm not swaying too much, but it's also important for them to start their planning early on before the care is needed.
Yeah, very, very good perspective and really framing it up in regards to the massive opportunity and need out there in our communities. And then, of course, you on a personal level, being a certified dementia care educator, you helped co-develop the Homewatch CareGivers Certified Dementia Care Training Program. Excellent in and of itself. Can you share a little bit of how person-centered care the dementia care differs from traditional approaches, especially for those aging without any of that family support that you talked about earlier?
Yeah, absolutely. So I had the honor of co-developing our certified dementia care certification trainee program with Dr. Alan Power. He's a geriatrician, author, and a dementia care expert. Our proprietary certification approaches care for those living with a diagnosis of dementia in a completely person-centered way, where our focus is really on strengthening the well-being of the individual and destigmatizing the disease. Too oftentimes people think of an expression from somebody living with dementia as a behavior. And when you think about it, the behaviors that you're seeing would be reactions from anybody else that would normally have to that same stimuli. But somebody living with dementia doesn't have the capacity to be able to communicate sometimes that the water's too hot, or it's hot in here, or I'm bored, or I'm hungry, or I need to use the restroom. So we seek to understand. We want to make sure that we're understanding what that relationship is and then de-emphasizing the need for medication. Too oftentimes people don't seek to know why, and they reach for that bottle of pills, which sometimes can be very harmful and increase the distress for that person living with dementia.
Well, thank you for that, Nicole. Of course, let's talk about some training as well. You've been all instrumental in really implementing some of the Homewatch CareGivers Academy learning management system, powerful stuff in and of itself. How has all of this professionally developed training platform, how has it improved both the caregiver retention and quality of care, and what makes it so effective?
Yeah, so we've aligned ourselves with a couple of LMSs over the years, but when we're seeking a solution for ongoing education, it has to be where we can upload our proprietary content. It has to include skills validation. So you can have somebody come to work for you and tell you that they know that they have experience in different areas. But if you cannot validate that skill set and fulfill your promise that is on your website that you have trained skilled caregivers, then you're doing a disservice to the community who is looking for that safe care for their loved ones. So we are able to, like I said, put our own content up there, not only to support caregivers, but everybody working in the organization. We also invite family caregivers to take advantage of that platform and to kind of learn more about what their loved ones are going through so that they, as a family caregiver, can better serve their loved one.
Also, Nicole, you talked earlier about your service within our military and some of the things that you experienced along the way and some of those jokes as well, which were quite timely for some of our community. I'm sure they'll love that. And, drawing both from your military background in Operation Desert Storm, and then, of course, those 35 years of incredible leadership in the healthcare industry. Nicole, what leadership principles have proven most valuable in building teams that deliver compassionate, high-quality care?
I think wise leadership is really don't expect your team to do anything that you wouldn't want to do yourself, to lead with compassion, to always provide support and an avenue for folks to continue to grow professionally. It's important to stay in touch with your team and not be an absent leader. Just rolling up your sleeves and getting in there and listening to what other people have. Their ideas may be on the cutting edge of innovation and you may have not thought of it, but together as a team, you can, stretch everybody's ideas into being something very productive.
We also focus a lot on this conversation around this very timely and needed to discuss topic of solo agers. But we also need to continue to remember the power of community, right? That is incredibly powerful. It is one central mechanism for mental health and well-being and physical health and well-being. It's the power of community to do so many positive things for a person. So, while we know that there's this growing dynamic and trend with solo agers in our communities, what are some practical steps that communities, neighborhoods, and local organizations can take right now to better support those solo agers before crisis situations develop?
Yeah, I'm glad you asked that question. So when I think about loneliness and isolation and how it affects people who are living alone, who either chose to solo age or maybe without support and not even knowing what resources are out there. But, a couple more statistics for you, Mike. Harvard Health Study said in 2022, and also research from the American Heart Association indicate that loneliness and social isolation raise the risk for heart disease up to 29% and are linked to a higher obesity rates. And these factors are chronic stressors inducing inflammation and promoting unhealthy behaviors. So I think it's really about understanding how the silent, what I like to call the plagues of the human spirit, can really affect somebody's overall health and well-being. So it is very important to stay connected in community. I know that a lot of communities, if people are living alone, they exchange phone numbers within neighbors so that, hey, if you don't see my trash barrels out on trash day, check in on me because something's probably going on. So it's really being, stitched in within community and just finding ways to socialize outside of the home so you don't get stuck indoors. It's very important to have that. There's signs that people may need assistance or that are struggling when they're solo agers. And some of that can just be simply neglected home and upkeep, personal hygiene, unexplained weight loss, unopened email, feelings of doom and depression, and just not attending community events like they used to. Maybe they aren't attending church services anymore. They're just not getting out of the home. So it just needs to be something that people really pay attention to as people start out wanting to solo age and then having it collide with loneliness and isolation.
Very good perspective. And thank you for highlighting that. Incredibly important, at least for me on a personal level. I know how important it is to have the power of community around you. It's incredibly, incredibly important and it's part of that journey of health and well-being, both on the physical, mental, emotional, and spiritual side of things. So thank you for highlighting that. Of course, Nicole, let's take this out into 2038 when the solo aging population may peak. What innovations in home care delivery, technology, or even caregiver training do you and the team believe will be most critical to meeting this growing need?
Well, I think, as I mentioned earlier, it's the technology and even considering, an AI component of technology. There's so many things that are being developed and people just need to feel comfortable embracing them and using them. I mentioned our technology vertical of our approach to care and, just there's always something that you can tack onto that technology for future, right? So It could be an AI caregiver, saying good morning to the client in the morning and checking out what do they need for the day and stuff. So I think it's just really staying current and making sure that it's cool to get old. Aging doesn't have to be a life of takeaways. It can be cool, and you can integrate technologies and AI to help them navigate the future of home care and healthcare in general.
Very, very true. And it is going to continue to change at a very rapid pace. So we better get with it and embrace it and understand the powers of what it can do for us in some very positive and strong ways as we continue to navigate these really futures that are coming at us very, very fast. So thank you for that. Then, of course, we got to discuss back to current state, how we in our community can be helping you and your team. What's one problem, need, or question that you and your team have that we can be helping you with?
Oh, I'm so glad you asked that question. Well, right now, I just want to let the listeners know that Homewatch CareGivers is always looking for compassionate, reliable individuals who want to be involved in making a difference in people's lives and people accepting support in their homes. I like to bring in our mission at that time, Mike, is to provide superior quality home care services which preserve dignity and independent safety for our clients and creating a compelling employment opportunity for our employees. So our focus is making care accessible and human, and our niche is delivering personalized, connected care that evolves. Our core values are passion to support people, integrating integrity. We have that we, not I mentality, inspiring excellence, and being authentic. And so your listeners, if it sounds like them, somebody they know that is looking for a position in the healthcare industry, we would love to have them visit our website, type in their zip code and find a location near them. Maybe they want to be a caregiver, or maybe they know somebody who needs care at home. So would invite people to visit our website and think about those opportunities.
Well, that's a perfect segue, Nicole. How do they find your website? What is the website? How do they find you and the team online?
Yeah, so homewatchcaregivers.com, and that's where they can plug in their zip code to find their area of a Homewatch Caregivers near them. They can connect with us on Facebook at facebook.com/Homewatch Caregivers. We can also be found on our LinkedIn page, which is linkedin.com/company/81893. And if you have any entrepreneurs that are listening, there's also franchising opportunities. So listeners can go to homewatchfranchise.com.
Excellent. Well, thank you for all of that, Nicole. And of course, before we start wrapping it up and bringing this to a close today, Nicole, we do have a fill in the blank for you. I'm a passionate pioneer because?
I am a passionate pioneer because I'm driven to use innovative technology and care approaches so people can safely thrive in their homes.
Excellent. Well, Nicole, thank you so much to you and the entire team. And of course, a big congratulations approaching your 22nd anniversary with the organization, an incredible feat, as we mentioned on the front end. But of course, Nicole, thank you so much for taking time out of your day to be with our community as well. Really appreciate it, rooting you on, following your journey. And of course, for our entire community, you can simply scroll on down into the episode notes to find all those contact points for Nicole and the team to continue these conversations and beyond. Or you can head over to our free global online community at passionatepioneers.com, where you can find all those contact points online and to find out how we can leave some comments, suggestions, or feedback for Nicole and her team, again, over at passionatepioneers.com. So again, thank you so much, Nicole, for being with us. We do appreciate it, and we look forward to continuing to follow your journey and all the wonderful things you and your team are helping to move our industry forward. Thank you so much.
Thank you for joining us today on Passionate Pioneers with Mike Baselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Baselli. I look forward to having you back with us during our next episode.